Since the early 1980s, HIV and AIDS have gone from being a crisis that changed the world to flying under the radar like they're not even a thing anymore. But the fact is that an estimated 1.1 million people aged 13 and older are HIV positive in the United States, according to the CDC. That includes an estimated 162,500 who are undiagnosed. That's 15%. Physicians diagnose about 38,000 new patients each year. So it is still a thing. And there still isn't a cure for HIV and AIDS. Once more for the folks in the back, there is no cure for AIDS and HIV. So you gotta take this thing seriously. I'm Torri, Parade's resident health guru, and I'm here to sort through medical fact and fiction with the help of our friends at the Cleveland Clinic, especially on topics where it just feels like there's too much information. This is the TMI Show. Now, when it comes to HIV and AIDS, there's actually some good news. There have been a lot of medical advancements in treatment over the past 40 years that, again, aren't cures, but allow people who are HIV positive to lead pretty regular lives. But first, a little communicable disease 101.
The principle is sound. To avoid illness, expose yourself to germs, enabling your immune system to develop antibodies. I don't know why everyone doesn't do this.
HIV, human immunodeficiency virus, is the virus that causes the disease AIDS, acquired immunodeficiency syndrome. And you cannot contract HIV from touching, hugging, or breathing the same air as someone with AIDS. It also can't be transmitted via doorknobs, public bathrooms and toilet seats,
swimming pools, water fountains, cups, utensils, phones, bug bites, or exercise equipment.
You cannot catch it changing locks. You cannot catch it winding clocks. You can only get HIV when infected body fluids, meaning blood, semen, fluids from the vagina, or breast milk, enter your bloodstream. The virus enters your bloodstream through broken skin or the linings of the mouth, anus, or sex organs. That's the penis and vagina.
That's a lot of information to get in 30 seconds.
Sex without condoms and sharing needles to take drugs with an infected person are the most common ways people contract HIV. And the only way to know if you have HIV or AIDS is to get tested. Now that's important because if you don't know you have it, you can infect others. Stopping the spread means being honest with yourself about your risky behaviors, bucking up, and going to the nearest health clinic for a simple test. Check the link in the description for places to get tested. Of course, the best thing to do is to keep from getting infected in the first place. Now, there are a few classic HIV prevention methods, namely abstinence, obviously, and using condoms.
Don't have sex in the missionary position, don't have sex standing up. Just don't do it, promise? Okay, everybody take some rubbers.
But maybe you've heard of something called PrEP. That means pre-exposure prophylaxis. Acronym station, yeah. PrEP is a daily pill taken by people at risk for HIV to prevent infection. PrEP contains the same medicines that people with HIV use to stay healthy. And if you are exposed to HIV, these medicines can stop the virus from multiplying and spreading throughout your body. PrEP only works if you have enough medicine in your body, so you need to take PrEP every day. When taken correctly, studies have shown that PrEP reduces the risk of getting HIV from sex by over 90%. The risk for injectable drug users is reduced by at least 70%. But PrEP is not a vaccine, it's only for people without HIV who are at risk for getting the virus from drug injections or sex. It's recommended, for instance, if your partner is HIV positive. Also, PrEP does not protect you from all the other nasty STDs you could get from unprotected sex, like gonorrhea and chlamydia. So being prepped for sex still means wrapping it up.
I'm Winston, good to see you again.
Chevron, hi.
You got a condom on you?
Oh, no, look, that's not where, her mother and my mother, I'm a chemical engineer.
Winston! Look, Chevron, man to man, I know you have a condom in your wallet, but my question to you is, you actually think you're gonna get lucky with a sexy lady like that?
There's also something called PEP, or post-exposure prophylaxis. Post-exposure prophylaxis! Post means after, and prophylaxis means prevention. So PEP can prevent HIV after you've been exposed to it. Certain HIV drugs can be prescribed by a doctor to be used as PEP, and they must be started within 72 hours after a possible exposure to HIV. Not 120 hours, not 96 hours, 72 hours. PEP should be used only in emergency situations. If you think you've been exposed to HIV, talk to your healthcare provider or an emergency room doctor about PrEP right away. The fact that PrEP is available should not keep you from taking steps from preventing HIV, like safe sex and PrEP if that's something you and your doctor agree is appropriate for you. Living with HIV is very different than it used to be, thanks to medications that can protect yourself and others. Treatments for HIV, called highly active antiretroviral therapy, or HAART, can improve and extend the lives of many people who are HIV positive, actually reducing the amount of virus in the blood levels so low it doesn't show up in blood tests. But even if you can live with HIV, you don't want to. The fact that it's treatable is great, but HIV weakens your immune system, so you're at higher risk for other infections, many of which are very serious, like hepatitis C and tuberculosis. And now you know. There's no cure for HIV, but there are more ways to stay safe and live a healthy life than ever. Thanks, medical science. Got a TMI question? Let me know in the comments. Thanks for watching, and don't forget to like and subscribe. We'll be back with more of the most TMI topics you can imagine.